So mental hygiene, it is the branch of psychiatry. It is one of the branches of psychiatry, which is associated with science, practice of, and also practice of the main thing is to maintain, preserve, and restore. Maintain, preserve, and restore mental health. Preventing mental mental illness through appropriate treatment and counseling. So what is mental hygiene? Mental hygiene, this is one of the branch of psychiatry, and it is also associated with the science. Then the aim is to maintain, preserve, restore the mental health. To maintain the mental health, preserve the mental health, and restore the mental health. And preventing the mental illness. To prevent the mental illness through proper treatment and counseling. So through proper treatment and counseling, the mental illness can be prevented. Definition of mental hygiene. According to W.J. Colville, according to W.J. Colville, T.W. Costello, and F.L. Rocky, mental hygiene consists of measures to reduce the incidence of mental hygiene consists of measures to reduce the incidence of mental illness of mental illness through prevention and early treatment. Prevention and early treatment. And to promote mental health. So, the definition of mental hygiene is according to W.J. Colville. Mental hygiene consists of measures mental hygiene mainly reduce the incidence of mental illness through prevention of mental health, early treatment for the person who are suffering from mental diseases, maybe depression, stress, and for those type of patient, early treatment should be done, and also promote the mental health. The mental health also should be promoted. Next is the objective of mental hygiene. So objective, the first one is to maintain, restore and promote the mental health. Maintain, restore, promote the mental health. And to prevent illness. So the first point is to maintain, restore, promote mental health and prevent illness. The next objective is to ensure effective adjustment of an individual with various situations. To make adjustment of an individual in various situations. So in any kind of situation, the individual should be able to make adjustment. This is also one of the objective of mental hygiene. The next point is the third point, to help the people to recognize their potentialities. This is the third point. That means the people will be able to recognize their abilities and potentialities. The fourth one is to develop self-respect and respect for others. So to develop self-respect is important for mental hygiene. It should be developed, and also others should also be respect. The respect for others should also be developed. That is the fourth objective. So there are four objectives. The first one is to maintain, restore, promote mental health and to prevent illness. The second one is to make adjustment of an individual in various situations. And the third one is to help the people to recognize their potentialities. And the fourth one is to develop self-respect and respect for others. So these are the objective. Now we will see the principles. Principles of mental hygiene. So when we talk about the principles, it means the methods and roles which will help the people in maintaining and restoring their health. These are the rules and the methods. And it will also help in preventing the mental illness and maladjustment. Maladjustment, the person who are not able to adjust. So first of all, the first principle is the first point is for attaining good mental health, people should maintain their own self-respect and should respect the feeling of others. Maintain self-respect. This is the first point. And respect the feelings of others. So this is the first point, and the second one is they should try to realize strength and weakness of self and others. Realize strength and weakness of others. This is the second point. The third point is they should try to understand, people should try to understand others' motive, needs, desire. People should try to understand others' needs, motive, desire. So this is the third point. So the people should try to understand others' needs. What are the needs of others? What do they want? What is their motive? And what is their desire? All these things should be understood. The next point is people should try to set goals only which they can achieve. So this is the fourth point. The fourth point is people should try to set goals. They should set goals which they can achieve, which is they should not set the goals, their goals or target which they will not be able to achieve. That is the fourth point. The fifth one is eat well balanced diet. Eat well, balanced diet, exercise regularly, do exercise regularly, physically active. These are also important for mental hygiene. The person should be always active. He or she should not be idle, should not be lazy, should be always active and enjoy hobbies. To have a good mental hygiene, enjoying hobbies is also one of the main principles. And also think positive. The person should be always positive. This is the fifth point. The sixth point is people should share their feelings with others. Share their feelings